Hello everybody, my name is Dr. Emery Pitcel. I'm a chiropractor and the owner of Rothrock Chiropractic Rehabilitation. We are located in State College, Pennsylvania. We are continuing on with the review of our McKenzie and thoracic spine exercise packet. So if you are a patient of ours and had some neck pain, there's a possible chance that you've been given this exercise. Now, this one isn't as common as the previous exercises that we went over. So those who are part of the general population and happened upon this video, you might want to review our retraction and retraction with extensions because we don't see as many people needing rotation. However, I will still demo the rotational exercises for those who have been prescribed that, so that way you can do them properly and effectively at home. So they can be done seated, they can be done standing. For the sake of this demo, I'm going to sit and show them. So what we're going to do first is we're going to have our head, and in the previous video, we taught people how to go all the way back into retraction. So taught them how to go all the way back. Now with this, you're going only about a quarter to half of the way into a retraction movement. And the reason why you're doing that is that's just enough to pull the rest of the spine nice and elongated and neutral and slightly corrected. So again, maybe just a slight partial retraction. For the sake of this video, I'm going to demo right rotation. Certainly there's going to, if we're going to find a directional preference in rotational concept, it's going to be either right or left. We do tell patients that if they do want to do a couple of stretches back the other way, that's fine. But you really want to make sure your number and ratio is like 3 parts or 4 parts to 1. Example, if I'm doing 10 over to my right, then I don't really want to come back and do any more than 3 back over to my left to maybe balance out the neck. So again, partial retraction. Then what you do is you turn that head as far as you can, and then take the opposite hand, put it on the chin, give a little overpressure. 1, 2, bring it all back to neutral. Partial retract, turn, overpressure with the fingers, 1, 2, and come back forward. Again, respecting pain tolerance. So if you're coming all the way over and you're like, that's my 4 out of 10, should I add finger overpressure to make it hurt like a 6 out of 10? No, you should not. 4 is the limit with any exercise we do in here. And just for the sake of demo, partial retraction, back to the left, give it a little overpressure push, come back forward. So again, I did 3 parts that way. I would at most want to only do 1 more part left to maybe make things feel a little more balanced out. So what do these exercises work particularly well for? Again, they're not as commonly prescribed as the regular retraction exercises, but we do find that if a patient has a little bit of an odd type of cervical strain presentation that really favors one side over the other, then working into one directional of rotation might be the directional preference. We find if there's a lateral canal stenosis on the spine there and the patient needs to go that way to open up the nerve root and the nerve sleeve on the other side to cut down some of those stenosis and the foraminal compression signs, then that could be beneficial. We have seen sometimes where there's a tension headache that favors predominantly one side, and that person does a really nice job doing the rotations a way to really stretch out that opposite side to cut the headache pain down. Again, not as commonly given as an exercise, but we do see it from time to time, hence why we wanted to take a moment to make the video. So if you did just happen upon this video and part of the general populace and this was a beneficial exercise, great. We are happy for you. Make sure to like, comment, and share this video, subscribe to the channel. And if you're part of our patient population and this was your given exercise and this review helped, again, we're happy for you. That's why we took the time to make them. In the meantime, from Rothrock Chiropractic, I'm Dr. Emery. Thank you for watching to the end of the video. Take care until next time.